Hi, everyone. I'd like to welcome you to the Specialty Nursing Info Session. This session will be presented by Kathy Kennedy, Jan Morrison, Cindy Chang, Farah Jatha, Lara Parker, and Carly Elidius. Carly, I'm sorry if I said that wrong. Before we get started, the British Columbia Institute of Technology acknowledges that our campuses are located on the unceded traditional territories of the Coast Salish nations of Squamish, Tsleil-Waututh, and Musqueam. And now I hand it over to Kathy Kennedy, the Associate Dean of Specialty Nursing.
All right, thank you very much, Julie. Thank you so much for joining us today. We're really happy to have the opportunity to speak about some of our specialty nursing programs here at BCIT. We do have 10 programs in total and an 11th program, which is our core BSN, which we'll also be speaking about today. And for the purposes of this session, we'll be talking about the perioperative nursing specialty, the perinatal nursing specialty, critical care, and the neonatal nursing specialty. But you can see that we have a number of other nursing specialties as well. So please feel free, if you're interested in any of those we're not presenting about today, to take a look at our website and get accustomed to what we have to offer there. So in specialty nursing, very, very popular across the province and across Canada with regards to educating registered nurses in a variety of these areas. We've been very busy during the pandemic, certainly in many of our programs, to ensure that we have throughput of nurses to be able to continue to fill the healthcare system. So thank you, Julie. On to the next slide. So something that is fantastic about specialty nursing, obviously these are courses that we deliver for RNs that are looking to be working in specialized areas within the healthcare field in nursing. But we also offer our programs to diploma RNs that are looking to move towards earning their BSN, and Jan Morrison will be speaking about that shortly after me. We also have alternate pathways for licensed practical nurses in two areas. One is in nephrology and one in perioperative. And you'll be hearing about perioperative shortly as well. And we also have courses for BSN learners to take prerequisite courses in their BSN training. They can take our prereqs to move towards specialty education. And we also have an amazing pathway through specialty nursing into the UVic Masters of Nursing, where you receive credit for several of the courses that you've taken as well. So a very good choice to move forward with. Next slide, Julie. So there are two ways that learners go through our programs. You can certainly do it through part-time delivery, where you're going kind of course by course and moving along at your own pace. You have 7 years in total to complete that education. That does work very well if you're working currently, already nursing and trying to kind of carve out space as you move through. We also do deliver what we call a compressed time frame delivery. And so this is usually arranged through sponsorship. Nurses are sponsored through their health authorities and come through our programs, and they're able to complete the course much quicker. And so it's done in a full-time capacity with a combination of online learning, classroom learning, simulation in lab, and that clinical. On to the next slide. Julie, thank you, perfect. So a question we always get, people are always very interested in what does that mean and what does that look like for their clinical practicum. So we place students anywhere, a number of different facilities across the province, across Canada with regards to their clinical placements. We just need to make sure it aligns with the competencies and the learning outcomes for that clinical rotation that you're in. So we have arrangements and partnerships across all of those hospitals, and we can make sure that that's within your area of where you live. Also, just to be aware of, we do use multiple sites, and at times your clinical rotations, particularly if done in a preceptorship model, can be doing shifts work as well. We also have instructor-led clinicals, so it really depends on what type of clinical that you're in with regards to whether you're doing shift work or not. And it just, as a heads up, students are responsible for their own transportation and accommodation while they're in their clinical placements. But as mentioned, we do try to place you close to where you live and geographically what works best for you. But at times it might be slightly a different site than what you had requested, but we try our very best to ensure that we accommodate. Next slide, Julie. So who is it for? We're going to be talking about that in each one of our presentations today. But certainly, as I mentioned, for active registered nurses who are looking to specialize into certain areas, that's what specialty nursing is for. We have diploma RNs seeking to earn their BSN. And we've got licensed practical nurses, as I mentioned, in perioperative nephrology areas. We have undergraduate health students looking at some of our elective courses. We have numerous elective courses through specialty nursing. And then, as I mentioned, we've got RNs that are looking at completing their Masters of Nursing through UVic. So once they've completed any of our specialty nursing certificates, they move through that UVic pathway to complete their Masters. Next slide, Julie. So I do encourage you to visit our website and look at what are the options that are available for you. There's lots of commonalities between what is required to gain access into our programs, but as it states, each one is a specific specialty nursing area. And so if there's something that you're strongly passionate about, I really encourage you to reach out to the program head in that area. They can talk you through what's involved and answer any more specific questions. And with that in mind, we have a few of our program heads here today, and we're going to be talking with Jan Morrison next, and Jan's going to be going over the BSN core program. Over to you, Jan.
Well, thanks, Kathy. Yes, who is this for? So this is a program for diploma prepared RNs who want to move through to their Bachelor of Science in Nursing with a specialty certification. Next slide, please. So this graphic, I think, lays it out pretty well. You start off with your diploma. You would take one of our nursing specialty certificates. That would be about 27 credits. And then you would go on from there to the BSN pathway, core nursing theory courses, liberal ed courses, and electives. That's another 33 credits. And when you have 60 credits, you would achieve your BSN in specialty nursing. So it's kind of a nice, well-defined pathway. I did this similar path several years ago, many years ago, and it was a very difficult process to navigate. I think BCIT, we make it quite streamlined for you. So yeah, a lot of people are interested in our program because it gives you the professional development needed to apply for additional positions in teaching and leadership and in community health. If you look on our website, you can find the application process. It's a good idea to collect up all your documents, transcripts, additional documents if you need them, create a BCIT ID and submit your application. Monitor your BCIT email for letters from admissions. I get some students emailing me saying, I applied and I never heard back. But then you need to be checking your BCIT email, which we will create on that site for communication. Next slide. I'm really happy to talk with anybody who has questions about the program. Please feel free to contact me, and I can help you understand how your education and experience will fit into our process. Yeah. Thank you. Onward and upward here. Cindy, take it away.
All right, thanks, Jan. Hi, everyone. Good afternoon. So I'm going to be talking about perioperative nursing. So what is perioperative nursing? For those who are unfamiliar, these are nurses that ensure safe care and support patients throughout the surgery. And examples that you might have heard of or had experienced yourself with surgery, common ones are removal of gallbladder, an appendix, or you may have had a knee scope before, or even cesarean section. So we offer various surgical services, and then one of them, a fun example I like to give from a plastic surgery is that we had a young patient come in and to get an extra connective tissue under their tongue removed so that they could lick ice cream and then also speak better. So that was very exciting. So at the end of the day, one of the most rewarding parts about perioperative nursing is being able to fix a problem and ultimately giving the patient an opportunity for a better quality of life. Next slide, please. So who is this for? Like Kathy mentioned already, we offer 3 pathways in our program. So one is the RNs and BSNs who would like to work in the OR and obtain an advanced certificate in perioperative specialty nursing. The second pathway is for LPNs who like to advance their education and scope of practice to work in the OR. And then our third one is for perinatal nurses who like to expand their scope of practice and taking part in a cesarean section on a surgical team. Next slide, please. And then, so this is a quick overview of what our program looks like for an RN, a BSN, and also for LPN. And so on the right-hand side, you'll see a nice little graph that has 6 courses in the program. And then in total, it's 25 credits. So we have 3 theory courses in blue, and then also the 3 clinical courses that are in pink. The clinical courses are delivered in a preceptorship model, and all the theory courses are delivered through distance, so online. Right. And then you'll see that the perioperative perinatal is 10 credits, so it's a modified program. All right, thanks. And then so career outlook. So the BCIT Advanced Certificate will prepare you in a number of ways. So working with patients ranging from infants to the elderly, and then also providing a variety of surgeries that I mentioned before already. And then also an opportunity to work in rural or tertiary care facilities or even private surgical centers. And so it's not always in the hospital. And then there's also opportunities for perioperative nurses to expand their roles. So an example I've given here is RNFA, which is a registered nurse first assistant. And then so they assist the surgeon during the surgery. We actually had one of our graduates from our program. She's in progress in obtaining her RNFA. So it's very exciting to see that happen. All right, next slide. And then, so this is a student that we had in our perioperative program, and I'm just going to read out one of her testimony. The BCIT perioperative program has been an incredible guide to starting my new career as a perioperative nurse. All right, next slide. And then here are some more of what students have said about our program for the perioperative nursing. I'm just going to give you a few moments to read it over. And if you have any more questions about the program, feel free to reach out to me. My contact information is on the next slide. There, and you can also reach out to our program assistant, Stephanie Strong, who you may be in contact with. And then, so the next speaker I have is Farah. She'll be talking to you about perinatal nursing. Thanks.
Thank you so much, Cindy. Good afternoon, everybody. My name is Farah Jetta, and I'm the program head for the perinatal specialty, and we welcome you here to the information session. So perinatal, what is perinatal? The perinatal specialty is, registered nurses working in partnership with childbearing individuals, their newborns, and their families, really to provide nursing care, education, support to patients and their families throughout the trajectory of starting from pregnancy all into labor and birth, and then into post-delivery called postpartum, and then the first sort of few weeks of the newborn. And like all of our nursing environments, perinatal nursing clinical context is also very dynamic. It's ever-changing, it's unpredictable. And so perinatal nursing really requires a strong knowledge base, technical expertise, very sort of strong clinical decision-making skills, and relational nursing practice. One of the sort of the things we know about perinatal nursing is that the nurse is sort of in the middle of the whole sort of context of what's happening, and other healthcare providers come in and out, but it's the perinatal nurse that really is in the middle of everything, especially in labor and birth. So having those relational nursing skills are essential. Next slide, please, Julie. So who is this for? Like Cindy said in her program, and Kathy said earlier, this is for active registered nurses that are seeking an advanced sort of perinatal nursing certification to work in our perinatal birthing units. Undergraduate nurses that are currently completing an accredited BSN program. And when we think about sort of traits or characteristics of people that are wanting to work in the specialty, you know, really sort of enjoying working directly with women, newborns, and their families. We always tell people that come into our program that you should be very flexible, and you should be very sort of okay being around a lot of family members. There's a lot of family members, usually not as much with COVID, obviously, but usually lots of different family members coming and going. Thrive in a very fast-paced, dynamic, unpredictable environment. Have very strong organization, prioritization skills, because things are changing so very quickly, and working with multiple patients sometimes. Strong communication skills, because not only are you communicating with patients and their families, but you're communicating with multiple healthcare team members that are also coming in and out of the situation. And again, as we talk clinical decision-making skills, be really strong as an effective team member working in a multidisciplinary team, adaptable, flexible. You really don't know what's coming around the corner, especially when you're working in a birthing unit. You could have a mother that's coming in, you know, that is in early labor and may be sent home, or you even may have somebody else coming in who is in strong labor that might be imminently delivering. So that aspect of the unknown should be something that maybe you seek out or that you enjoy doing. Knowing when to ask for support, so really understanding your own strengths and knowing when to ask for help, and then being really self-reflective as a practitioner. Next slide, Julie. So program overview, this is a benchmark for perinatal practice in BC. So nurses working in perinatal units, this is the program that nurses are completing in order to work in the units, in the hospitals in British Columbia. It's a comprehensive program like all of the specialty programs in BCIT that combine in-depth theory, simulation, and strong clinical courses delivered by very knowledgeable and very sort of passionate and experienced faculty. As Kathy Kennedy mentioned earlier, this is a part-time program that can be completed course by course with an average of about 2 years, or can also be completed in a different pathway called a sponsored pathway, which is sort of more of a full-time pathway, which I can answer questions about later or individually as well. And because this is distance, as Kathy Kennedy mentioned, gives you lots of flexibility while you study or work or have other life events happen. Next slide, Julie. So this is a 24 credit program, and as you can see, the courses are listed there. We've got theory courses, we've got three theory courses, a couple of workshops. Our workshops are 1 credit courses, which are $72.50 and $74.50. I won't inundate you sort of with the specifics of the courses, but we've got 3 theory courses, which are 3 credits each, 2 workshops, which are 1 credit each, and then the 2 clinical courses, which are 5 credits each, and a 3 credit elective. If you're interested in our electives, we've got a whole slew of electives listed in our website on the web. The blue courses that are listed are for those that might be interested in taking some of our courses while in BSN programs. So 7100 is our Theory 1 course, 7150 is our infant feeding course, and 7450 is a neonatal resuscitation program or NRP course. These are courses that really fit well NEONATAL in undergraduate studies, because they really help you after graduation to start working in a postpartum or a post-delivery hospital unit that can really sort of help the transition into perinatal quite nicely. So those are the 3 courses that are highly recommended for BSN learners. Next slide, Julie. And then, where can people work with this specialty? So again, primarily, as I mentioned, in sort of those acute care birthing units in the Lower Mainland, in the province, and then other work opportunities could be sort of in the community or the public health sector, really working as a public health nurse with, families that have delivered and have gone home, supporting with breastfeeding, supporting with immunizations, and then also working on sort of pregnancy or antepartum units, and then post-delivery or postpartum units in the hospital settings. Next slide. And then this is just some of our team and some of sort of what people have said, what learners have said in the past. So I'll just give you a couple of minutes to read over some of the comments. And if you have any questions, of course, my contact information is on the next slide and on our website as well. We've also got a wonderful program assistant, Zoe Lai, and she'll be happy to answer your questions as well. So please feel free to reach out. And I'll now hand it over to Lara Parker. Thanks so much.
Hi, everyone. Good afternoon. My name is Lara Parker. I'm the program head for the critical care nursing specialty at BCIT. Again, welcome. So critical care and the practice of critical care, the nurses there work in a really dynamic and fast-paced critical care units. The critical care units in the province of BC can actually be multiple different ones. There is the intensive care, known as the ICU, coronary care, known as the CCU. Cardiac surgery intensive care has multiple names, but usually goes by the acronym CSICU. And there's also the post-anesthetic care unit, which commonly is called the PACU. So the BCIT critical care education program provides the platform to be able to work in any of those areas. Critical care nursing itself provides care to patients and families experiencing typically life-threatening illnesses and supporting them on their journey of healing and the entire experience of being in a critical care environment. We work within a strong interdisciplinary team. It's definitely a team that helps these patients and families on their trajectories. We typically have some strong technical expertise, excellent communication skills, strong critical thinking and decision-making skills, and typically a lifelong dedication to learning, as there's always new research, new ideas, new medications, new pandemics for us to navigate. Next slide, please. So who is this for? Anybody who's a practicing registered nurse who's wanting an advanced critical care nursing certification. We also provide the first 2 courses of our programs for students in an undergraduate nursing program that is accredited. So any accredited BSN program, 3rd and 4th year students usually can take the first 2 courses of our program. Definitely for people working practicing nurses who are interested in working with acutely changing patients, typically, as I mentioned, requiring full supportive care and thrive in a fast-paced, technology-based, rapidly changing environment. Next slide, please. So as mentioned, it's an exciting and dynamic program that prepares registered nurses with the knowledge, skills, and critical thinking abilities. And I already listed on the previous slide all the different areas that this program can prepare you to work in. Next slide, please. So our program does consist of 27 credits. You can see them listed there from 7120 to 7620. It is a combination of theory and clinical. And I think one of the amazing things about all of the BCIT specialty programs is the amount of clinical time where you have that opportunity to connect theory and clinical application together. Our program creates exceptionally strong, confident, novice critical care graduates ready to begin work in the practice arena that they have chosen. As outlined, there is sponsored full-time options that are opportunities available, and there's also an ability to take the program part-time, course by course, term by term. Next slide, please. Again, as others have provided some great quotes from the students that have taken our program, a lot of connection to the support that was available, that the instructors that we teach in our program are approachable, and that how the clinical really tied the connection piece together with that hands-on practice. I'll have a minute there just to let you take a look at some of those very happy smiling faces of some of the students that have been in our program and have graduated. So next slide, please. If anybody has any questions, definitely happy to answer any of them. My contact number is there as well as the administrative assistant, Jenna, who is also very versed in anything in relation to the delivery of the program. Thank you. And I'm going to be passing it on to yes, Carly.
Hi, everybody. Good afternoon. Sorry, just one second here. Like Laura said, my name is Carly Iliades. I'm the program head for the neonatal program here at BCIT. So what is neonatal? Neonatal nursing is a subspecialty of nursing that works with newborn infants born with a variety of problems, ranging from prematurity to infections, birth defects, surgical problems, lots of different variety, but they're always newborn infants. Next slide, Julie. So as with the other programs that you've heard about today, this program is very similar. It's for practicing nurses wanting an advanced certificate or to complete their Bachelor of Science in Nursing. We do also have undergrads in our program, and they can currently take the first two theory courses during their BSN. Okay. We do prefer 6 months of relevant work experience in an acute care setting, but that is really just a preference. And we do accept new grads directly into our program. And of course, this program is for people who enjoy working directly with infants and their families and can apply sensitivity and compassion in a really high stress work environment. Okay, next slide. So the neonatal program is designed for nurses who are interested in working in the neonatal intensive care unit. As a neonatal nurse, you would care for premature or sick newborns right from birth up until just discharge from the hospital. The neonatal period is technically considered the first month of life. However, neonatal nurses care for infants from birth until discharge, which can be several months or even up to a year in some really difficult cases. For the most part in the NICU, we care for premature infants, but we also do care for term newborns who have certain risk factors such as infections or congenital anomalies. People who generally enjoy working in this area, obviously usually really like babies, but also really enjoy working with and supporting families. Family-centered care is really at the forefront of what we do. In the NICU, it's also a very fast-paced environment, but it's also very scheduled, and we work in a very methodic and organized way. We look after infants, like I said, ranging from extremely premature infants who are requiring mechanical ventilation, central venous access, multiple medications, right up to babies that we call feeders and growers, who are the babies that are just learning how to feed and just need to grow a little bit before they can go home. Another major focus of neonatal nursing is providing trauma-informed and developmentally supportive care to infants. We've really learned a lot over the past several years about how stressful and traumatic the NICU environment can be for both infants and their families. So our main focus is really providing supportive care to ensure positive neurodevelopmental outcomes. Their brains, these little babies' brains grow so much while they're in the NICU, and the care that we provide as neonatal nurses really does have a tremendous impact on both their long and short-term outcomes. Okay, next slide, please. Again, similar to a lot of the other programs, the neonatal program is a 24-credit program. There are 14 credits of core courses, which are a combination of both theory and clinical. And then there are 10 elective credits. From these elective credits, you can choose from some of our neonatal options, or you can also choose electives from some of the other specialty nursing programs, such as pediatrics, perinatal, breastfeeding, palliative care. There's really lots and lots of different options. And there are also multiple paths to becoming a neonatal nurse. So like I said before, you can take our first 2 theory courses in your undergrad. Then you might do your final preceptorship in the NICU and go straight into working full-time in a NICU after graduation. Or you might finish your BSN, work for a while in another area, and then decide to specialize. So there is, like the other programs, options to take our courses one by one, or else there is the option of the Health Authority sponsored compressed timeframe program. Next slide, please. Again, just some student testimonials. I'll let you guys read that. I think my favorite one is the one about now I have the greatest job ever. I agree with that. The last slide is just my contact information and the contact information of our program assistants. So please don't hesitate to reach out if you have any questions at all. We're happy to answer them. Thank you.
Thank you, Carly. Okay, now we're going to open it up to questions and answers. We've had some great questions in our chat and we're going to address them one by one. So I'm going to just read them out from the top of the list. And Christy, if I know you've been monitoring as well, so if I miss anything, please just let me know. Jenny asked, I just finished my 2nd year of the BSCN program at TRU and was wondering if it is better to start my specialty courses now or wait until I am working after I have received my degree. So Thompson Rivers University student wants to know if she should start her specialty courses now or wait until after she's working.
I'm happy to answer that question, and if any of the others want to jump in. It's a great question, Jenny. Thank you for asking it. And I think what's most important is you can certainly take the prerequisite courses or early theory courses in the specialty areas in your undergrad. We do think it's best that you take it closer to when it's applicable. So for example, for the emergency program or critical care, high acuity, they have a dysrhythmia course as one of the prerequisite courses. And so you want to be taking that course close to when you're actually going to be using that skill. And, you know, it's one of those things, if you don't sort of use it and consolidate it right away, you can kind of lose that skill. So just try to time it in such a way that it's pertinent to the work that you're doing in your BSN program and that you're able to consolidate that skill. Very common right now, we have a high number of BSN students across the globe who are taking our prerequisite courses as their electives while still in your BSN program. So I hope I answered that question for you.
Thank you, Kathy. Our next question is, can someone take more than one course in the part-time program? From Kelly.
I'm happy to jump in on that one as well. Great question, Kelly. We get that question a fair amount. Our courses are sequential, so you need to take one and then that becomes a prerequisite for the next one and so on. So it's would be unusual if they were co-requisites or you were taking them at the same time. So it's at this point, one course at a time as you move through.
Thanks again. Next question from Jenny. What is the difference between the critical care and high acuity care specialties? Great question.
I think I'm going to let Lara answer that question. She might be the best.
Hi, thank you. Yes, I can answer that question. Thanks. It's a great question and a common question these days. BCIT does have a full high acuity program. It's a 24 credit program. They just aren't able to speak to it, but there's lots of information on the website. I think one of the biggest differences between the high acuity program and the critical care program is not so much the patient diagnosis that we worked with, but some of the advanced acuity. So, for example, a critical care nurse is looking after a fully ventilated, so on life support, breathing machine, along with many other interventions. The high acuity patient population can also be on many different forms of inotropes and IV medications, however, would not be requiring the advanced mechanical ventilation, if that helps. So that's a large distinguishing factor about it. Otherwise, though, we do see very similar patient populations. And, as the pandemic has taught us in the critical care areas, there's certainly a merging of this patient population because we see people who have infections. We have people who have trauma. And so the level of care varies, but it really circulates in around sometimes the respiratory support that we provide that patient populations. But at the moment, they stand as two distinct programs, each with their own specialized population. And the critical care program, as mentioned, is about a 27 credit program, and the high acuity program is a 24 credit program. Hopefully that answers the question a little bit, and certainly a lot more information on our websites as well.
Thanks, Lara. Next question. How does clinical work in a part-time study? Will it become full-time clinicals then? For part-time study, can you take breaks in between the courses? After completion of the program, how does the hiring process work? And finally, can I apply to a specific unit afterwards? I'm just going to repost this from Michelle in the chat so that we can address all of those questions.
Great questions. I'm happy to tackle a few of these. So you're right, Michelle, when it does move to the clinical portion, it really does become full-time. We don't like to break up the clinical into parts because you've got that continuity and you're able to consolidate the learning as you're moving through. So when it does come to the clinical, we would ask that you would dedicate that time in a full-time capacity to complete. And so there's depending on what specialty area you're looking for. Some clinicals full-time would be about 4 weeks in total on average. So it just depends which specialty you're looking for. The other question, for a part-time study, can you take breaks? Absolutely. So if you're doing this program in a part-time study format, course by course, you can certainly complete a course, take a break, and then come back and do the next course and so on. That is the absolute benefit of doing it in a part-time study format. What a lot of students do is move through course by course, and then when it comes to their clinical time, they may have taken vacation from, their other role and then completed their clinical with us during that time and then back into the coursework. Let's see, after the completion of the part-time program, how does the hiring process work? And can I apply to a specific unit afterwards? Also good question. So there's two kind of approaches to this, and I actually think there may be a question further down about getting sponsorship. So if you're going through independently as what we call independent learner, and you're putting yourself through the program, certainly reach out to whichever health authority that you feel like you would like to work with. We always do encourage people to also speak to the managers on those units as well. It's nice if they sort of get to know who you are and let them know that you're taking the program. Our programs are the main throughput across the province to work in all specialty areas. So the managers are very, very familiar, and we work collaboratively with them as well. It's not uncommon if you've done your clinical on a specific unit that manager often hires you in that unit if they have vacant lines and they need more employees at that point. So I would definitely say it's important to get to know the manager. But there's HR process across all health authorities. They have a professional practice area, and they would be able to help funnel you to the right place where you want to work. But if there's a specific unit that you're really drawn to that you want to work in, I would suggest also connecting with the manager there. I don't know if any of the other program heads on here have any other thoughts with regards to, nurses are being needed everywhere. And so I think they'd be thrilled to hear from you, but I'm I don't know if any of the other program heads had any thoughts about the employment piece if you're going through independently. I guess that we all, I think we all feel the same about that then. Thank you. I hope I answered your questions, Michelle.
We have another question from Rose. Is there any prereq of needing to have 1 year of med-surg work experience prior to studying these specialties? That's what I've been told, but I'm wondering how true that is. And how would we go about getting sponsored for a specialty? Who do we approach?
Great question, Rose. I think as Carly had mentioned, it's always good to have some acute care experience, but we are not, you know, a lot of people graduate nursing school with a really clear idea of where they want to work in a specialty area. And we absolutely take brand new grads out of nursing school into our specialty programs. That is a very straight path. And so it's not necessary that you have 1 year of med-surg work experience. And you will hear that. That was kind of an old philosophy years ago that was the case. But I really do think that many of our new grads going into specialty areas are doing successfully, transitioning into those areas. So again, I think as a lot of the program heads have spoken here, if you're strong and passionate about the areas that you want to work in and dedicated to get there, then you absolutely can. And about getting sponsored, I think I maybe answered that earlier, but there will be postings up in each health authority, and within the job posting, like say it was in a critical care area, it'll say that the requirement is that you take the BCIT program and they sponsor you through it. So I would keep your eyes out there, postings everywhere. This is a wonderful time for you to get sponsorship and in working in any of the specialty areas. So I would keep your eye out, and they pay for you to take the program, they pay for your tuition and your time. And so it's really truly very fortunate, you know, way to kind of move through your school and your education.
Our next question is, what's the schedule look like per week? For example, the nursing specialty emergency.
So I can speak specifically to the emergency program. It's a hybrid of classroom days and clinical. So usually in clinical 3 days a week, and attending classroom courses either online or in person or simulation labs in the other 2 days. So it's 5 days a week for the emergency program. It is a little bit different for each specialty area, but specifically for the Emerge program, it's Monday through Friday. Yeah, I think, and I know that on some of the other areas, they do have weekends, like critical care. I think, Lara, your program is over the weekend as well. I hope I've answered that.
I see lots of thank yous and great information that was delivered in our Q&A. I'll give another moment if anybody has any other questions. Otherwise, I think one more question from Kelly.
There's also a question there about critical care.
Oh, shoot.
It says, I see that for critical care, the theory too is with clinical. So would this be full-time as well? I'll let Lara answer that question.
Oh, yes. Okay. Yeah. Sorry, I did miss that question as well. I think that's in relation to the NSCC 7220 course. It is a 3-credit course where 2 credits is theory and 1 credit is clinical, which is about actually only 25 hours. We consider it almost a living lab clinical. So depending on how you're taking the program, if you're just doing it as an independent or distance learner, it is still delivered in a term at BCIT, which is over 12 weeks. And so that means you can still continue to work in whatever capacity you are and take the courses. The clinical is arranged, as we've kind of alluded to. It's a focus. So again, it's a very short clinical. It's 25 hours. And so that would look like 2 or 3 shifts together. So not considered really a full time. And if you're in the sponsored program, the 7220, again, is a little bit delivered over a distance capacity. And then we have a again, 2 or 3 days of delivered clinical time. So hopefully that answers that question for you. Great question. Thank you.
Thanks, Lara. We have a question. How many hours to commit for studying?
That's a good question, Kelly. And so usually what we say is for a theory course, for 1 credit is 15 hours. So if it was a 3-credit course, then we would say it would be about 45 hours of study time for that course for completion, give or take, other things that you do as an individual to study. But, and then for clinical, it's usually 25 hours per 1 credit. So, a 5-hour or a 5-credit course would be 125 hours of time. I hope that helps. And study groups are great. It's always lovely when you are going through with somebody and you can kind of work together through the coursework. Doing it full time, it is intensive, and you really can't be working or doing other things as you're moving through. But it's also a really fantastic way to consolidate and move through the program.
We have another question. I'm curious about the nephrology specialty. I was wondering if you could speak to that program structure and schedule. And before that's answered, I'm just going to ask Darren just to put a link in to the last nephrology session, to the last, just a YouTube link in there in the chat, and then you'll be able to watch our last session there. And if anybody wants to take that on with the nephrology, the structure and the schedule.
That's it. Thanks. That's great. I'm happy that you have the link. And we did do the nephrology in our last info session, so that would be a great place for you to start, Rose, with regards to learning about it. Tony is the program head for that, and he would be happy to chat with you if you want to reach out and connect with him, and he can kind of go over the specifics of their schedule and their structure. But they're also a hybrid program. They have a lot of online learning, some classroom days, some simulation days, and then a significant amount of clinical experience, much like all of the programs have expressed. And something that's very exciting for us, if you're calling in from the Lower Mainland, we have our brand new health sciences center, which will be open for us in the fall. And so we're very excited. It's going to be a center of excellence for simulation. We're very excited to be moving all of our simulation labs and classrooms and so on out of that building. So we look forward to seeing some of you there.
And with that, I invite you all to take a look. Oh, Darren just posted the last session for nephrology in the chat. Everyone here will receive a PDF of the slide deck and a link to the video recording. This screen right here just shows our social handles. We have a great community online where we show information about things that we're doing on campus, highlight different programs. Sometimes students take over accounts and you get to see what it's like for them on campus. The learn more links are there on the right hand side. You're welcome to take a look at any of those if you wanted to tour the campus or find out more about any of our other programs. And with that, get my mouse here. I'd like to thank everybody. I'd like to thank Kathy, our Associate Dean, Cindy, Lara, Carly, Jan, Farah. I hope I'm not missing anyone. Everyone that presented today, Darren behind the scenes, helping us with our links and our chat, and Christy Walters as well. So thank you, everyone. Have a wonderful afternoon, and please feel free to reach out if you have any more questions. Take care.